So some of you guys may already know that the World Schizophrenia Day was on 24th of May this year. That was a few days ago. And I noticed that there's a lot of myths going on. There's a lot of misinformation going on, and I just want to share facts about schizophrenia today, just so that you are informed. If this video is something you'll be interested in watching, kindly come along, click the like button, please, and subscribe, and also share. Hi guys, it's your girl again, Damilola. Welcome to my channel. It's called Dami's Little Corner, DLC for short. And in this video, I'll be talking about schizophrenia. And this is the first episode of Mentally Speaking. So all my videos on mental health will be called Mentally Speaking. This will be the first episode. So welcome. Let's get right into it. I'm sure some people may be wondering that why do we have to celebrate days, label some days as like World Schizophrenia Day, World this day, World that day. I think the aim of the people who put those days in place is for us to be able to share information about those conditions, be able to create awareness to people about those conditions, and that's what I'll be doing today. Today I'll be talking about schizophrenia. So come along with me. So what exactly is schizophrenia? Most doctors will describe schizophrenia as a form of psychosis, really. So it's usually a long-term illness. It's a chronic illness that it involves disorders of thought process, disorders of behavior, disorder of mood and perception. The major things to hold is that it's a chronic illness, and the disorder can affect the thoughts of someone who's affected by it. It can affect the mood, it can affect the person's perception and the person's behavior. So in the world, it is generally understood that about 1% of the population in a lifetime would experience schizophrenia. So it's not as common as some other mental health conditions, like bipolar affective disorder. It's not as common as that. And also, 1 in 300 people worldwide, according to the WHO, presently suffer from schizophrenia, and that's about 24 million people in the world presently having schizophrenia. And also, some school of thoughts believe that there is a slight um, difference in the amount of males that have it compared to females, and that's about a ratio of 1.4 to 1. So if you have one woman having schizophrenia, you have about 1.4 males with schizophrenia. And it's also shown that males usually start to have symptoms earlier in life compared to women. So you will see males in the late adolescence and early adulthood experiencing that's the onset, that's the timing of onset for males, but for females is usually later, sometimes around the late 20s. So you would have been wondering what exactly causes schizophrenia, what exactly brings it up. From research, it has not been shown that there's a particular thing that causes schizophrenia. So schizophrenia occurs due to a combination of things. It's interaction of things, genetic components, and also environmental components. So genetic component, like a family member having schizophrenia, a parent having schizophrenia. Then environmental factors, there could be triggers like substance use, like use of street drugs can trigger it. And people are generally the level of vulnerability of different people are different. So some people are maybe more vulnerable to having it compared to other people. So life events, negative life events like loss of a loved one, loss of someone's job, loss of things like that. Things are like sexual abuse, childhood trauma, things like that can bring it up and trigger it. And so a constellation of those things, genetic factors and environmental factors, are those things that bring causes to happen. So there's no particular cause of schizophrenia. also, I'll move on now to talk about symptoms. What are the things that you will notice in someone who has schizophrenia? Let me just point this out now that schizophrenia, as I said, is a chronic illness, just like high blood pressure and high blood sugar. And at this point, it has no cure. It can only be treated. Moving on to the symptoms, I talked about different things that you would notice. I would just like to divide the symptoms into positive and negative symptoms so that you would be able to follow me. So positive symptoms, you have things like hallucination. It's just a big word for saying that someone, for example, now someone could say he or she is hearing voices that are not there. Like you're with someone in the room and the person is like, didn't you just hear that? Someone is talking to me, someone is telling me things, and you're there, there's no other person in the room, and you can't hear that voice. That person may be having auditory hallucination. And then other people can say, oh, I can see a spider. Oh, I can see people in my room with me. Or you are with that person and you can't see any other thing with that person. That could be a form of visual hallucination. There are other types of hallucination, tactile hallucination, someone feeling that there's a touch, whereas there's actually nothing happening. So that's about hallucination. The other positive symptom is delusion. It's when someone holds on strongly to believe that is actually not true. For example, I could say that as I am in the room now, I feel that I'm being monitored. Like there are cameras in this room with me that are monitoring me, whereas in the real sense, there's actually no camera. There are also other types of delusion, but that's just an example I will give now. Also, there could be a problem with the thought process. The person can believe that there are some people stealing their thoughts from them. That's like thought withdrawal. There's some people may say that I feel that my everybody knows my thoughts now. Like I would say that is like a form of thought broadcast. I wouldn't really go in depth into them because I'm not trying to make you psychiatrist. I'm just trying to make you aware of symptoms that people can have and how you can actually come into the negative side of the symptoms. You can see someone who was the life of the party or who is someone that is very jovial, and the person starts just withdrawing to themselves. They don't want to interact with people, they don't want to talk to anybody, they're just indoors. And another thing is someone who is very clean, takes care of themselves. You just notice that the person doesn't really take care of himself anymore. The person doesn't care about how they do, the person doesn't care about their personal hygiene, they don't care to have a bath and things like that. Those are examples of negative. So let me move on from symptoms. I'm sure I've not exhausted the symptoms, but those are things that you could look out for. I'll move on from symptoms. Impact this illness can have on people's life. So as I mentioned, they get withdrawn. This can affect very great impact that it can affect their social life. Someone who has been very, very social would just start being withdrawn. It can affect their interaction with family. The family members are like, what's happening? And this person can't really give them an explanation as to what exactly is happening. And this can also lead to breakdown of relationships. It can affect occupation. It can affect occupational functioning. Imagine someone who is always up and about, and the person starts being withdrawn and staying back in their house instead of going out on their daily activities, going out to work. It can affect occupational functioning. It can affect functioning in all aspects of life. Another impact is that, and that's what the society does to people with schizophrenia. They start stigmatizing. There's a lot of stigma around mental health illness. There's stigmatization. People who have schizophrenia are at risk of human rights violation, being treated as lesser than they actually are. Those are the things. Those are the impacts of schizophrenia on these people. And also, it's been shown from research that they are at higher risk of actually committing suicide. These people don't know what is going on with themselves. This is not who they used to be, and it can lead to them to going to committing suicide. It's also been shown from research that they are at higher risk of actually dying earlier. So those are some of the impacts that schizophrenia can have. Let me just point this out, that for mental illnesses in general, including schizophrenia, people who suffer from mental illness may not even know that they have this mental illness, may not even recognize that they have this challenge, they may not recognize that there's an issue. So family members are picking up things like, someone who is hearing voices now will probably want to respond to those voices. They are picking up odd behavior, they're picking up them interacting with people that cannot be seen, responding to unseen stimuli, and these people feel that they're just still being normal, like nothing is wrong with them. So they cannot really recognize that they have a problem. That is quite common with mental illness, and it's called lack of insight. I brought that up so that if you're a family member and you see that you're telling your family, or you're telling your friend that you have a problem, and the person is saying no, you should be able to understand why they are saying no. It's not because they want to be like that, they just cannot recognize that there's an issue and there's a problem that needs to be solved. So I've talked about the symptoms, I've talked about causes, I've talked about impacts on the person's life. I'll be going to talk about what you can do to try and support them, try and be around them. For someone who's been living with schizophrenia for a while, there are some things that you will pick up to know that this person is about to calm down with a mental breakdown, or mental or relapse, as we call it in the medical language. You can notice that this person has not been sleeping well as he used to. That's one of the popular symptoms. That's one of the common symptoms that you notice when someone is about to suffer a breakdown. So keep an eye open for things that you would be pointers, that will be pointers to someone about to have a mental breakdown. Also remind them to use their medications, is to remind them about their hospital appointments, and to support them throughout, to support them against violation of their human rights. So something I forgot to bring up earlier is that schizophrenia does not have tests for diagnosis. So you can't say, let's do some blood tests to diagnose these symptoms. And this was very common in my practice when I was in Nigeria. I would see patients that really just wanted us to do tests to diagnose what was wrong with them. Whereas you just have to interact with the psychiatrist or with the mental health professional, and that's your diagnosis will be made. You don't need a CT scan to diagnose of schizophrenia. You don't need an MRI. You don't need blood tests. I would say people really don't know these things. You don't need these things. You can use those tests to exclude other diagnoses, other things like physical things, like brain issues, brain conditions, but you can't use those tests to diagnose schizophrenia. They are only diagnosed by assessments, by interacting with a mental health professional. Also, as regards treatment, it is important that schizophrenia is recognized early. The earlier the diagnosis and the earlier the treatment, the better the prognosis of schizophrenia. So it's very important that when you see these symptoms, you go to your doctor, go to your GP, and interact with them so that a diagnosis can be made and treatment can be started. So treatment is done by using antipsychotics and also therapy. So it goes hand in hand. Antipsychotic medication as determined by the psychiatrist managing you, and also talk therapy, psychotherapy, cognitive behavioral therapy can be used hand in hand. The last thing I'll be talking about is talking about the myths. I will be debunking a lot of myths, and the first one I would like to talk about is that people have said that schizophrenic people are just lazy. I want to say that they are not just lazy. The fact that they don't tend to themselves, they don't groom themselves as they used to, they don't interact with other people, they don't want to go to work and do other things that they used to do, doesn't classify them as lazy. It's just that they are actually not able to do those things because they have a mental illness. Also, some people have said schizophrenia is a result of bad parenting. I would definitely want to become that now. Schizophrenia is caused by genetic and environmental factors interacting together, and it has nothing to do with bad parenting. They've also said that people who are schizophrenic are violent, they're dangerous people. I wouldn't say so. It could get to a point that some people who have severe form of schizophrenia may get violent, but in my practice, I've not actually encountered a lot of dangerous or violent schizophrenics. They can have poor functioning and all of that, but I wouldn't say I've seen a lot of dangerous and violent schizophrenic people. So please don't treat them as violent as and dangerous as you see when you meet them. The other thing is that people believe that schizophrenic people should be institutionalized, they should be in hospitals or prison, and I wouldn't agree with this. Schizophrenic people belong to the society as far as they are under treatment and they are not relapsing. So there's no need for them to be institutionalized and put into the hospital. They can function independently in society. That's one of the myths that people have. People think that if your parents have it or if your siblings have schizophrenia, you will definitely have schizophrenia. I remember there's a thing in my culture. I don't know if it's everywhere, but I know in my culture, the people would go to some people's houses to do investigations about the illnesses they have, about if they have mental illness in particular, so that if they have, maybe you prevent your child from getting married into that family and all of that. But what people don't realize is that mental illnesses are caused, most of them are caused by an interaction of genetic and environmental factors. So you wouldn't say that because this father the person's father has a mental illness, the child or the daughter would definitely, or the son will definitely have it. It doesn't work that way. So that's a myth I also want to debunk. The fact that if a parent has a mental illness does not automatically qualify the child for having it also. This is very common, a very common myth amongst Nigerians. I don't know if it's common in other places, but I've worked in Nigeria for a significant portion of my career, and that is that mental illnesses are due to witches and wizards, spiritual forces, and I would like to debunk that and say that mental illness is just an illness, just like high blood pressure and diabetes, that can be treated by medications, and that's why people get better when they take antipsychotics and they use therapy. So that particular thing of thinking that there are spiritual problems have actually led people to seek help in the wrong places. People go to places where they are scammed, where they have to buy a lot of materials, a lot of things, just just for the sake of looking for a cure for these conditions, and they end up spending all their resources and not getting the treatment that they need. So it's a physical health condition. It's just like a physical health condition, but there are mental health conditions, and it can be treated. Another myth is that medications being used, antipsychotics are taken to cure the person. I also saw that a lot in my practice in Nigeria, and one of the things I usually tell people when I see them first is that this is a chronic illness, just like high blood pressure, just like diabetes, just like any other medical condition you can come up with that is chronic, and it's the medications that will be prescribed to you are not prescribed to cure you. They are prescribed to help you manage your symptoms in such a way that you can function normally in the society, you can function with your family, go to your workplace, function generally without any problems. So I explain that to people that these medications don't cure you, they only help you to function, they only help to minimize your symptoms and control your symptoms. Okay, I think I've exhausted my list. If you have any questions, any contributions, you can put it down in the comment section. I would like to hear your experience. I would like to hear what your thoughts are, and if you have any questions, any things you would like me to discuss next, just put it down in the comment section and I'll be happy to do that. Thank you so much for watching this episode of Mentally Speaking. Please like this video if you found it helpful, subscribe to my channel if you found this video helpful, and any other video that you've seen up on my channel, please share to your friends. The purpose of making this video is for you to have information about things like schizophrenia, about other mental health conditions also as time goes on. Thank you so much for watching this episode of Mentally Speaking, and I hope to see you